Hello and welcome to this special edition of Dance Mama Live. We are broadcasting live today from Dance Hub in Birmingham. Hello everybody, give us a quick woo! Who's here live? Yeah, they're here live. And we are also obviously on Zoom, and for those of you in the future who will be watching, this is your way that you can take part on your schedule, and that's very much at the heart of what Dance Mama is about. So on today's webinar, we have the wonderful Dr. Nicky Keay, who is going to be talking to us about hormones, potential and human activity, particularly for mothers who work in the dance sector. Nicky is an absolutely extraordinary person. She's brilliant. Not only is she trained as a GP, she has got a huge amount of knowledge and experience in her field, as well as working on the ground with dance companies like Scottish Ballet, where she is a resident there. So without further ado, I'm going to bring Nicky on, who's going to do some brilliant work with us. And again, this is a conversation that is not being had in many spaces, particularly to do with parenting, that we've been able to bring to you. So Nicky, welcome.
Thank you so much for that kind introduction. Yeah, it's a real honor and privilege to be beaming in to you from a very wet London here. Anyway, as Lucy said, yeah, I'm a medical doctor with this particular expertise in hormones, and my dance is also my passion, by the way. So I've been dancing personally since I was like about 4 or whatever it was, and I'm still doing 4 classes a week. Hooray! And yeah, just a little shameless plug for my book. And I was just telling Lucy earlier that, yeah, it's a bit of a stress this weekend. Someone has cut off my usual Insta, so I've now got a new Insta link anyway, where I post lots of extra information and, of course, the book itself for some more details. So talking about dancing and my passion for dance, things have changed over the years in terms of dance, the demands of dance, and quite rightly, if you want to have children, that shouldn't be the end of your career, whatever it is, by the way, and certainly not dancing. But we have to also accept that there are increasing demands of performance. And this is actually over 2 pictures I always love to show. My grandmother is on the left of your screen. She's from the 1920s, in her early 20s. She's on point, which is quite impressive. They had these strange point shoes, by the way, which had a crisscross thing, a bit like a Scottish dance shoe. Anyway, and then that's me 2 generations later on the right, about the same age. And number one, this is to show that dance is in my family, to prove my credentials, as it were, but also, actually, I want you just to observe that, the demands have changed even within our family in terms of what we're expected to do now. My grandmother is on point, but she's on 2 feet. I'm on 1 foot. I've got the tighter fitting tutu. So we have to accept that there's more pressure or increasing demands from dance, but also we want to still, as women, we have the option to have our children and carry on with our careers. My grandmother had my mother, obviously, and I've actually got two grown-up boys now as well. So I wasn't a professional dancer, but and I do know the challenges, shall we say, of being pregnant and getting back into dance. Even though I wasn't a professional, at a reasonable level, I know what that feels like and what it is. So I think that's important to give that personal touch. So this is what I want to talk to you today. By the way, don't worry, I definitely won't talk for more than 40 minutes, all right? I promise Lucy that. And then I will stop, and then I hope that invite you all to ask questions and get involved and get the discussion going further. But I'm just going to sort of walk through a little bit what hormones are, so you're familiar with what we're going to be really talking about. And then go through the female hormone odyssey, as I'm calling it, with, of course, a particular focus on those reproductive years and being a dance mama. So first of all, just to set the scene, what are hormones? And the word hormone is actually derived from the ancient Greek meaning setting in motion. And that's literally what hormones do. They bring to life our DNA. So the DNA, as you know, the blueprint for life in all the DNA in all the cells in your body. But how is that actually expressed? How does that find its voice, as it were? And it's down to the hormones that go in to the cell nucleus, into the DNA, and they determine which genes are going to be expressed and which proteins to be produced. And so that, from what I've just said, it's pretty clear, I hope, that these hormones are really important, setting in motion our path, hopefully, to optimal health and dance performance. Out of all the hormone systems in the body, I always enjoy this bit, the most complicated and the most beautiful is that, look at this, feast your eyes on the choreography here in front of you. I mean, that is a masterpiece, is it not? This is what happens with your hormones every time you have a menstrual cycle. So, you know, I will be using some of these words probably, so maybe just a quick run through what I mean by the menstrual cycle in hormone terms. So at the start of each menstrual cycle, there's the menstruation bit, the bleeding bit, the period, okay? And you can see that actually all of those hormones are sort of on the lower side. And now we go into what's called the follicular phase. The follicle, that's the name for the developing eggs and the ovaries. So this is when the eggs are being sort of vying for a position of prima ballerina, effectively. The dominant follicle will be selected, and you can see that follicle will be ovulated, released. And that is triggered by, look at all those big increases, the crescendo of estradiol, LH, and FSH. So that stimulates ovulation. So the egg's now released from the ovaries and wends its way down towards the uterus. And maybe that's where it's going to get fertilized. After ovulation's occurred, we now enter the second phase of the menstrual cycle, the so-called luteal phase. And you can see now the dotted blue line, you can see that's now progesterone is the dominant, and that is now the prima ballerina of this menstrual cycle. And so that is, in essence, what's happening with this complex choreography. But the key thing is that every single woman, everyone listening today is different. You're going to be different in terms of the subtle timing of when these hormones do change. You're also going to have different levels. If we do blood tests, you're going to have slightly different levels. We won't all have identical levels. And crucially, we will all have an individual biological response to these hormones. So even if it's the same level of progesterone in two women, one might feel totally different to the other. One might say, I feel fine. The other one might say, well, actually, I'm feeling a little bit premenstrual. So there's a lot of variation, but that's great. We are individuals after all. So going back to sort of in general terms, hormones, these internal chemical messengers transported in the bloodstream that set in motion our DNA. These have, of course, a big impact on both our physical and mental health. But in some ways, it's also good news that our hormones are influenced by our choices around, as dancers, we have a choice to a certain extent. You know, exercise in terms of how many classes, how many performances, you know, within reason, we have some sort of control over that. Also our sleep and our recovery and our nutrition. And these things impact how effectively and efficiently our hormones work. So that's actually quite good news, because now this gives us some leverage into harnessing these amazing hormones to optimize our health and performance. So you can see there I've listed those three things that we have control over. And the aim is to try and get each of those in the optimal zone all at the same time, which is a little bit tricky, as we all know, but that's the principle of it. And this is actually, hopefully, this diagram is pretty empowering, I hope, because you can see you can get the most out of your hormones by bearing in mind that you can take actions to really harness them. So let's put this into context. So that's sort of the theory behind what hormones are and how they influence our health and performance as dancers. But now just sort of going through the time course of these hormones. Now, I suppose it starts off with the very first question: are dancers born or made? And that quite rightly, there's a lot of emphasis on maternal health. So obviously, as a mother, we want to be as fit and healthy as possible because we instinctively know that this is going to be good for our baby and frankly good for us. So we can, go through pregnancy and childbirth and be in a healthy and fit state to, look after our child. So it's very important for the mother, but actually it's also definitely important for the baby, because there's what's happening as the baby is developing inside your uterus. There's what's happening, a process called prenatal programming. And this is, as this diagram shows, so as mothers, we have our own hormones circulating, of course, and lots of hormones coming from the placenta. And these have a direct effect on the baby. So, of course, the baby has got its own DNA right there. But again, remembering that the DNA is going to be switched on by hormones. And so already, when your baby is developing inside you, your hormones are what's called epigenetic tuning. So the baby's DNA, of course, is fixed, but how that is going to be expressed when it enters the real world, the outside world, that's what's called epigenetic tuning. And we know we got evidence that this happens because mothers who were pregnant during severe starvation times, for example, we know that this affects the developing baby. Of course, it's going to be a small baby, but actually also it's determining how the baby's hormones are going to be secreted when it's born. And so this is what, there are some words here which I will explain. So endocrine phenotype means how are the hormones going to be secreted by the baby when it's born, okay? The phenotype, so that means this sort of like external appearance, or in this case, the manifestation of which hormones are going to be produced, how many, what, when, etc. And the aim while the baby is developing is, of course, you're trying to match up and prepare the baby for the world it's going to be born into. Okay, so you're trying to do this environmental match. You're trying to match this up through the epigenetic fine-tuning so that the baby will be all ready and set to go when it's born. And this goes back to the starvation thing. If the baby is realizing inside that actually it's going to be born into a world where there's not much food around, then it will be fine-tuning the hormones already to be sort of what's called a thrifty phenotype. So it's going to grab food. But actually what happens is that this can be passed on for future generations. So now sometimes we have this environmental mismatch where it's anticipated that the situation might be a world where there isn't much food, but then unfortunately, the baby's born and actually everyone's driving around in cars, lots of fast food, etc. And so actually there could be a mismatch which might not be good for the baby. So anyway, it's a little bit theoretical, but it's kind of to highlight the point that the hormones are getting fine-tuned even as your baby's being developed. So now the baby is born and she's a female baby, and so going through her journey in terms of what's going to happen with her hormones, just a little bit of a revision, just again some words I think are useful to know for dancers, that her periods will start. Average age is 12, age of menarche as it's called, but certainly we know in dancers this can be a little bit later because of their training, their exercise, but certainly there is a hard cut. By the 16th birthday, periods should have started. If they haven't, this is what's called primary amenorrhea, and that should be looked into. And sometimes I see this in dancers and athletes who are frankly overdoing the training and haven't quite got that right balance of their external behaviors. Once periods are underway, the menstrual cycle length can be anything from 22 to 35 days. That's entirely normal. Again, I have lots of dancers coming concerned saying, oh, my cycle isn't exactly 28 days. Well, that's not a surprise. So long as it's within that range, that's fine. If there are fewer periods, if periods are really spread out, less than 9 per year, then again, that could be something that needs looking into. And certainly if periods stop for more than 6 months, now that's called secondary amenorrhea, okay? So lack of periods. And again, this needs looking into from a medical point of view. And then considering this whole female hormone odyssey, as I like calling it, you know, periods will stop when you reach the menopause average age of 51. So looking into this this journey in a little bit more detail, so you've already seen this diagram. So when menstrual cycles are happening, there can be some flash points in this cycle, okay? So it's typically reported that you should feel great, apparently, here when the estrogen is ramping up. And this is said, oh, you should feel fantastic. You should, 32 foetus on point, no problem. Theoretically, but not everybody will feel like that. So I think that's important to stress, that if you do feel great during that phase of your cycle, brilliant, fantastic, no worries. But if you don't, then again, that's again individual variation. The luteal phase, if you remember, when the progesterone is the predominant hormone, that, in my experience, tends to be the more problematic time for some dancers, because this progesterone increases metabolic rate, so the rate at which you use energy. You literally need an extra 300 kilocalories per day to meet this extra demand. And it raises your body temperature. This is the theory behind the ovulation thermometer, so you know you've ovulated. And can literally leave you feeling hot and bothered. So certainly at Scottish Ballet, you know, some dancers find it useful to sort of chart what happens during their cycle, so they can be proactive and know if there's going to be a problematic phase of the cycle for them, and make sure they're ready for opening night of Coppelia, which I saw recently, which was amazing. Anyway, so just to stress that menstrual cycles, it's normal physiology. It's a sign of internal healthy hormones. And unfortunately, there are still, you know, not so much, I would like to think, in the UK, but there are still some dance companies where it's seen as normal, or if anything, a badge of honor if periods stop. But I'm here to say that's not correct information. It's actually a warning sign if your periods stop, because after all, these periods, they're a free monthly medical check. So it's like, hooray, we should be celebrating that. And also it's a good indicator. If you haven't got that balance right between nutrition and exercise, then actually, like I said, there's a training metric. It's giving you a warning sign. Your body's trying to warn you that things aren't quite right. So moving on to some of the challenges of the reproductive years. We've mentioned some flashpoints in the menstrual cycle itself, but what is quite a common condition, actually it's the second most common endocrine hormone condition behind diabetes. It's what's called PCOS, polycystic ovary syndrome. And what is that? Basically, it's diagnosed on having 2 out of 3 of these so-called Rotterdam criteria. Rotterdam was where they had this meeting. That's why it's called Rotterdam, by the way. Anyway, so two out of the 3 of irregular cycles. So, like I've said, fewer than 9 per calendar year. Clinical or biochemical evidence of high levels of testosterone. So clinical on the blood test, or biochemical in the sense that well, biochemical, sorry, I apologize, I said that the wrong way around. Biochemical from the blood test, clinical in terms of the consequences of high testosterone, in terms of hair growth, maybe unwanted hair growth, hirsutis, for example, and really bad skin. And on the ultrasound, you'll see lots of little follicles. Now, that sounds a pretty straightforward thing, doesn't it? It's like, okay, I can diagnose that, no worries. But in the small print underneath this definition, it says very clearly, although it is small print, in the absence of any other conditions giving this clinical picture. And one of those being in terms of variation in weight. Sometimes a dancer might restrict what they're eating intentionally, unintentionally, and then go back to normal. And so this causes a little bit of disruption of the hormones, because essentially PCOS is a mistiming of the hormones. So there are other things that can cause a mistiming of the hormones. So that's a little bit of a worry to me. I see that often dancers come and say, oh, I've been told I've got PCOS, but actually, no, they haven't got PCOS. And it's very important to distinguish what is a true PCOS, the syndrome, because the syndrome includes a metabolic component. In other words, not so, a bit like type 2 diabetes, I suppose, not so well able to deal with blood glucose control. And so but nevertheless, it's a common condition. If you have true PCOS, then it will really depend on what the woman wants. If she's concerned about hair growth, etc., then actually taking the contraceptive pill is quite good. It will lower the testosterone and help with skin problems. Obviously, if you're wanting to get pregnant, if the hormones are a little bit out of sync and you're not ovulating in a regular fashion, then, and you're saying, I want to get pregnant, then there might be ovulation induction might be indicated. If none of those apply, or then also we have to consider there might be metabolic consequences. So that's what I'm going to call it true PCOS, all right? But as I said, going back to this thing, when is it not PCOS, right? Actually, it's just because you got some multiple follicles in your ovaries because maybe your nutrition hasn't been exactly spot on. And the reason why this is so vitally important, chalk and cheese, you might be wondering, I put a whole selection of cheeses. That's what my ballet teacher used to say. I can't even remember what it was related to. It's like chalk and cheese, totally different things. They look the same, but they're not. You try and take a bite into chalk, you'll soon find out, right? So if the reason for irregular cycles and maybe lots of follicles on the ultrasound is not PCOS, but just PCO, that's just the way your ovaries look because you're a dancer and the nutrition isn't quite spot on, then of course that's going to be totally different management. I'll be encouraging that dancer to eat more carbohydrate. So that's the PCOS bit. The other common challenge for dancers during the reproductive years is actually if the periods switch off. Again, apologies for the long words, but you may well come across these. So just to break it down so you're totally aware what it is. So PCOS, if it's true PCOS, that's the problem with the ovaries, the mistiming the hormones at that level. But if the master controller in your brain, the hypothalamus and the pituitary, they're sort of a duo. The pituitary is the conductor of the endocrine orchestra. If the control center says, no, this dancer is under a lot of stress, maybe not fueling sufficiently, maybe not recovering enough, just like rehearsing and practicing all the time, then actually we need to economize and save energy. We need to switch off periods. And this is what happens, and it's called functional hypothalamic amenorrhea. Amenorrhea, lack of periods. Hypothalamic, control center. Functional is because it's a response to the imbalance in the dancer's behaviors. It's not a medical condition as such. And the significance of this is, as I've said here, apart from pregnancy and PCOS, any woman who doesn't have periods will have low estrogen. And by the way, estrogen is an amazing hormone. So this is how a dancer might end up with FHA, functional hypothalamic amenorrhea. So you remember this diagram from earlier, you're trying to get this balance of all these factors, healthy hormones, great performance and health, we hope. But if maybe as a dancer, you are not meeting your energy requirements, then you can end up in a situation of low energy availability. So this dancer in the center is looking very happy because she is taking on board sufficient energy to cover the energy demand from her dancing, and that leaves the residual energy availability sufficient to keep all the hormones happy and healthy and having regular cycles. This dancer over here, although eating the same amount, maybe has got extra rehearsals, practice, whatever it is, and so therefore is going to end up in low energy availability because they haven't factored in they actually need to eat a little bit more, this deficit here effectively. This is a dancer who intentionally is restricting what they're eating because they think that this will confer a performance advantage. Maybe they think they will conform to a certain shape or weight or whatever it might be. But if you're in the red here, it's not going to end well because this is what's going to happen. Dancers can end up in a situation of REDS, relative energy efficiency in sport. I know it says sport, everyone, but fear not. with Martin at Scottish Ballet and other ballet companies, we are trying to get this changed to Red D, so red relative energy deficiency in dance. But thank you, Lucy. Yes, exactly. But the net effect, the net thing is the same. Whatever it is, if you haven't got enough energy, your hormones will downregulate without a doubt. And if you're a woman, your periods will stop, and you're going to have lots of, that's going to have a knock-on adverse effects on your health. And crucially, look at this, performance. I've had lots of dancers who have ended up in Red D, I'm going to call it. And, they say, oh, well, I feel fine, but in reality, they're not really reaching their full potential. And mainly because they find it really that their brain is a little bit sluggish. They can't pick up those corrections quickly, the choreography quickly. So that's how it adversely impacts performance. So this is just like a little slide to remind you, apart from having periods for reproduction, of course, but yeah, you need that, that's self-evident, but also having cycles and having these amazing hormones coursing through our veins literally is very, very important for all dancers. Because if your periods stop, then you remember, look, where's our beautiful choreography gone? Right? All the hormones will just be downregulated, really super low like that. That's why it's a big, big problem. So, but on a positive note, assuming that that hasn't happened, and assuming that, you are a dancer and you've got pregnant, then what are the things? Some of you, I know there will be a mixed audience. Some of you will have already gone through this and sort of know this, but some of you may be thinking about another child, or you may not yet have a child. So I think it's helpful maybe just to run through. These are sort of some ground rules, as it were, for if you're a dancer and you're pregnant. So I've already mentioned how important maternal health is. So you can take some positive action in terms of your antenatal health. So in my opinion, keep doing what you're doing, dancing, obviously, but you really have to see how your body feels and what you're feeling. Because I know that if you're feeling a bit nauseous, doing forward port de bras and trying to do Allegro, it's just like not really, not nice. So, you have to be sensible. Folic acid, obviously super important. That's good evidence that helps reduce the risk of neural tube defects. So I think that hopefully we're all familiar with that. Also, I used to be part of the medical antenatal clinic. And so if you have a pre-existing condition like a thyroid issue, then you'll probably come and see, well, I don't do that anymore, but you will make sure you're being seen in the medical antenatal clinic, where we look at pre-existing or taking into account pre-existing medical conditions. So in early pregnancy, basically the first trimester, the first 12 weeks, this is how you pick up when you do the pregnancy test, this is what you're picking up when you pee on the stick and the line comes up blue, right? That one. It's actually measuring, did you know? Oops, sorry. It's measuring this, beta HCG, okay? And this is what's secreted by the fertilized egg, the embryo, before the placenta gets going. It secretes this hormone to make sure that the corpus luteum back in the ovary keeps producing progesterone to keep it. By the way, progesterone derives from progestation. Gestation is pregnancy, right? So progestation, that's why effectively the embryo takes care of itself and makes sure that this hormone is being secreted to maintain progesterone until the placenta is developed and starts kicking in. The bad side is this is the hormone that makes you feel sick, and in my experience, it's not morning sickness, is it? It's just feeling nauseous the whole flipping time. Again, but as I said, I got through that knowing that actually this is good. I'm feeling a bit nauseous because this is a good sign that the embryo is secreting lots of beta HCG. So that's helpful, positive thinking about it. And also top tips, I found that just having little nibbles of carbohydrate, a little bit of bread or something like that, it's helpful for that nauseous feeling. Also, you probably all know this, that you count your pregnancy from the date of your last menstrual period. So hopefully you've made a note of that, and then you count it in weeks from there. And nowadays, I think everyone has a scan, a nuchal scan, the thickness, the fat at the back of the cervical spine of the baby at around 12 weeks. I'm really showing my age now, because when I was pregnant for the first time, it was still a research tool. And so I volunteered myself to go and get it done at King's Hospital. But now I understand it's a routine thing. So that's, I guess you're all doing that already. Now, interestingly, so what's happening to your hormones when you're pregnant? So what's happening now, this is assuming now the placenta is in full swing. And you can see the placenta pumps out really high levels of estradiol and progesterone, really high, okay, just flat, maintained. And of course, because these are high, it says to the conductor of the endocrine orchestra, the pituitary gland, listen, we don't need any more of this stuff here, FSH and LH, because we don't need to do this period lark anymore, right? So that's, and if you do a blood test, yeah, these levels are super high. Which is good, I guess, you know, so you're really benefiting from these hormones. Also, you've got some extra hormones come into play. Prolactin, prolactation. So this is preparing you, the breast, to produce milk. So if you measure prolactin, that will also be high. And also this hormone, relaxin, beautifully named, sort of what it does what it says on the tin, relaxin. It well, it doesn't relax you, but it relaxes your soft tissue. It relaxes particularly the ligaments and tendons around the symphysis pubis at the front of the pelvis, so that when childbirth happens, there's going to be a little bit more give. But the thing about relaxin, that's its function. But as dancers, I know we can get a little bit carried away and think, hey, great, I'm really super flexy. I can do the full splits. I'm sure some of you can already, but I couldn't at that stage. Anyway, so it makes you way more flexible. So you can get really carried away and think, oh, this is brilliant, but please don't. Right? This is not what relaxing is designed for. It's designed for the pelvis, right? Not for doing extra stretches, because the thing is the ligaments and tendons actually protect the joint. So if you overstretch it, then actually you haven't got those safety mechanisms in place. So just be aware of that. So now we're moving into this the next 2 trimesters. So second trimester, you're going to start to feel the baby moving, and we have the 20-week anomaly scan. I'm sure you're familiar with that. And then the third trimester, basically that's the baby's, all the organs are formed by 12 weeks, which is simply mind-blowing to me, that everything is formed at 12 weeks. It's like, my goodness. And especially this third trimester, therefore, is just the baby's growing bigger. And also it's getting prepared for birth. So what's called surfactant is being secreted. So the fetal lungs, of course, when the baby's in the uterus, it's getting all its oxygen from the placenta, from the mother, right? But when it's born, then its lungs, so in the uterus, its lungs are just all shrunk down. They're not expanded. But when it's born, the lungs will have to expand. And actually, to expand, you know, when you blow into a balloon, it's really tough, right? Especially at the beginning, you're really struggling to blow in there. But don't worry, nature knows this. And so it produces this thing called surfactant to make it easier for the lungs to expand. So that's why having, you know, the baby being born premature, certainly, you know, 28 or even less nowadays, of course, it's hasn't grown sufficiently and won't have much body fat and gets very cold. But actually, quite a lot of the problem is that the lungs won't be prepared to do that expansion business. So now moving into childbirth. If you've been through this, well done. Yeah, there we go. This is the theory of what should happen during childbirth. It's divided into 3. So stage 1 is you know these, the contractions. Oh yes, don't we love them? And it's so weird, isn't it? The absolute agony, and then suddenly it's gone. It's like, that's really weird. For a moment, you're fine. And so you know all about when the contractions become more frequent, and then, okay, then the uterus is really going into full swing. And the point of all these contractions is so that the cervix fully dilates to 10 centimeters to accommodate the head, basically, of the baby coming out. So that's what happens with the contractions. Stage 2 is when the baby actually comes out. Hooray, at last, thank goodness. Phew. I can remember even to this day, and it's a long time ago because my boys are now 27 and 25, but I do remember, particularly for my first baby, I had to have forceps. He has got a very big head. But my second baby was, didn't have to have any intervention. But I do remember, I kind of got this memory of pain vaguely, but I do remember actually when he was coming out, you feel really elated. It's like, yeah, I don't know, it's really weird. Anyway, so the baby comes out, and then stage 3 is now the placenta should come out, the whole thing. Very occasionally, if that, some of it gets retained, and then that's a problem. But anyway, so those are the sort of stages of childbirth. And now what's going to happen afterwards? So, remember those that estradiol and progesterone was super high during pregnancy. Now, of course, guess what? Those are kind of plummeting down. And so it's no surprise that you're going to feel the mental effects of that. Plus, you've been through a, exhausting childbirth, whatever that might look like for you. You will still have high prolactin for the breastfeeding, and the relaxin is still high. So that, again, don't get carried away with the stretching, please. Just remember that. Absolutely get going, get moving as soon as you can. And of course, the good old pelvic floor, hooray, yes, you should be doing that. But again, just be conscious that things obviously are settling down and relaxing is still high. Because prolactin will be high, there can be a delay in your own periods coming back, or they might not even start again until you've stopped, if you are breastfeeding, till you've stopped breastfeeding, or at least prolactin's come down. But remember that potentially you can still be fertile. So that's why at the 6 week checkup, they'll always be talking about contraception. So bear that in mind. I know that the favorite is sort of the mini pill, but barrier method's fine, or whatever it is, just bear that in mind, that is something to be thinking about. So breastfeeding, guess what? That's my son, Jamie. Oh, anyway, so I mean, of course, I'm not here to lecture people you should breastfeed, but just to let you know that, the advantages are that you will transmit colostrum, which has got antibody IgA, and also this is very good for the gut microbiome, so the baby's gut microbiome, I mean. So there's lots of, from that point of view. Also, oxytocin is secreted when you breastfeed. That helps stimulate the release of the milk. And that is, guess what? The love hormone. So that's meant to help with bonding. And also, I do remember this when I was breastfeeding Jamie, I felt my uterus contracting. It's like, yes. So it helps pull it back into place. So that's good. But breastfeeding, it is high energy demand, more high energy and more energy demanding than the pregnancy itself, by the way. Interesting. And also high calcium demand. And if your periods haven't restarted, your estrogen will be low. And all these things might not be so good for your own bones. So just make sure you're looking after yourself if you are breastfeeding. It's high energy demand, high calcium demand, okay? So yeah, bear that in mind. So just winding up now. So that was actually, I've got the last bit of the female hormone odyssey. So just where have we been? Where have we gone? So we started over here when the hormones, this is when a female child, nothing's much happening with the female hormones. And then her cycle start, hopefully, age of menarche, if you remember, and hopefully she stays like this. We hope she doesn't go back to having the more loads. Remember the hypothalamic amenorrhea, when we hope that doesn't happen. That also happens, by the way, when you take the contraceptive pill. Anyway, so then hopefully you're going to go off on this little sidetrack. This is physiological amenorrhea. You're pregnant. Remember, estrogen, progesterone very high. And now we're just going to do the last little bit of this odyssey. We're going to go over here to menopause. And please notice, very interesting. Look, it's the exact symmetrical opposite of pregnant, right? Right, because we're going to see that estrogen and progesterone go very low. So just last bit about the menopause. So this is what your hormones were looking like. Now, menopause, what happens is that it's the ovaries that retire. Okay, so the ovaries stop producing eggs and hormones. That's why these are low. But the pituitary gland, the conductor of the endocrine orchestra, gets very cross and says, well, come on, what are you doing? And so this is why FSH and LH go very high. So if you do a blood test in a menopausal woman, this is what you will see. So we've gone through the unborn dancer, or is a dancer born or made, and the epigenetic effects of the mother. The young dancer, I think for young dancers, we must be very careful to not, mental and physical burnout and not expect them to train like an adult. And especially for dancing, neuromuscular skills, technique, very, very important. The teenage dancer, the hormones are waking up, certainly the reproductive hormone axis. And this is very important for peak bone mass, which is why I'm really concerned if I see a dancer whose periods haven't started after the age of 16. We've had the young dancer, again, the hormones can shut down if there isn't a good balance in training and nutrition. Hopefully, dance mamas, yay. And now, moving on this journey, when you get older and the menopause, then I think, actually, I'll just go back to that. Maybe we discuss that in discussions if people want to talk about that and, HRT and things like this for a dancer. But just to wrap up with the final slide, just to remind you where we started, the hormones are amazing, right? They set in motion your path to your personal optimal health and performance. And the good news is you can have a degree of control over them by really being aware of your behaviors as a dancer. And just a shameless plug for my book again, my new Insta. Yes, thank you. So yeah, I think I'll stop sharing now and look forward to any questions, discussions, things I haven't covered, you want more detail on.
Nicky, thank you so much for just fantastic. It's been so mind-blowingly wonderful. And just thank you for guiding us through that. And what I really love about Nicky's work in particular, one, it's that it's happening, but also all the metaphors with dance, and particularly in the book as well, I've got a copy here, it is so helpful in helping us learn about it. And I think for some of us, we might have that kind of knowledge around the menstrual cycle, but seeing the whole journey is really important, and also how that can help inform our training, because we know in sport and probably in the bigger companies, there's much more resource and ability to track things, and really that needs to be going across into the rest of the industry, particularly with freelancers and smaller companies, because it's information that we already need to know. I don't know if we've got any questions online. I'll let Pia wrangle that for a minute and see. But anybody live here, I'm just going to be looking over the laptop, those of you watching this back in future, that's what I'm doing. Has anybody got any questions in the room at the moment? They're all looking, what? Lucy's asking us to speak. I've got like about 700, so I'm happy to crack on with those. If you have got any, wave at me, because I'm trying to look in here and up there. It's all part of the fun, isn't it?
I'm definitely interested in more about the old dancer.
Great, yeah, that absolutely. Nicky, can you talk a little bit more about, in terms of more mature dancers, sort of perimenopause, menopause? I mean, from my layman's knowledge, and from listening to you now, I know it's that drop in estrogen, but from reading the book as well, it's the neurological help on neuromuscular function that gets affected, as well as bone health as well, doesn't it? So,
well, because these hormones, estradiol and progesterone, are so vital for physical and mental health. Yeah, I'm afraid the stark truth is that it is a little bit of a challenge. Okay, so the really challenging thing, I think, is that it's not an on-off switch. You don't go from having menstrual cycles to suddenly you wake up and it's like, oh, I'm menopausal, I haven't got periods. It's the perimenopause, the transition, that is pretty tricky, okay? Because there will be some cycles where you feel fine, and other cycles where the hormones are just not there, or not you're not ovulating, or just a little bit of a mess, shall I say? The timing is gone. So, in practical terms, what does this mean? It means that you definitely, as a dancer, should be looking to do more strength work, because you want to try and maintain a healthy body composition muscle. So the muscles, you need to maintain that. Strength work, don't worry, that word also fills me with absolute dread. You don't have to go to the gym, you'll be relieved to know. If you want to, please do, but I don't, right? I'm a Pilates teacher, so resistance bands, things like that, and actually dancing itself is already really, really good in terms of strength, and muscle tone. So really, but maybe you might want to do some extra bits and pieces to keep the muscle tone going. So that's sort of the exercise side. The nutrition side, make sure you're really ticking off your protein requirement, because again, it's all about this muscle. We need to maintain this strength. So the exercise itself, but also make sure you're backing that up with a decent intake of protein portion at every meal. If you're not doing so already, just make sure you're eating that. Also, vitamin D. Vitamin D, it's a strange one, because most vitamins you get through the diet, obviously, but the main source of vitamin D is the action of sunlight on your skin. But looking out the window here, that's definitely in short supply, right? So everybody should be taking vitamin D supplements. Lots of work specifically in dancers by my colleague, Dr. Roger Woolman, showing that, dancers, we exercise inside, so definitely everyone should be taking vitamin D, but especially during perimenopause and menopause, because vitamin D is essential for bones that we've already mentioned can be at risk if the estrogen's dropping. Also immune function, so you're going to get less illnesses and viral infections, and also muscle recovery. So plenty of good reasons why you should be taking vitamin D. So top tip, if you're not taking vitamin D, order some right now on Amazon or whatever, 1,000 international units per day. That's really important. So those are the sort of the top tips for negotiating lifestyle things for perimenopause, menopause. But then there is, of course, the question of HRT. All right, do you or don't you? When I talk about HRT, everyone says, oh, you're very pro HRT. I'm just giving, well, yes, I am, I suppose, but I'm just giving you, number one, the facts. And also I can be absolutely honest here and say personal experience. It is really helpful because, with increased life expectancy, we're going to be spending at least a third of our life in the menopausal state. And I don't know about you, but I'm intending to keep dancing as long as I can. And so I want to do everything I can to achieve that. So yes, I do the things I've mentioned to you, but also, yes, I am taking HRT. So the good thing about HRT, the only absolute contraindication, so the only women who cannot take HRT are those that have a personal history of breast cancer. Obviously, that's like a red rag to a bull. So yes, but thankfully there aren't, I do have a few women like that, so we can't go there, as it were, with HRT. But if you're in doubt, then I think there are way more positives than negatives in terms of your quality of life and reduce risk of health issues like osteoporosis and cardiovascular disease. Or at the very least, if you're uncertain, at least you try. Because that's what I say to a lot of dancers and athletes I work with. Okay, I explain, there is a slight increased risk of 4 extra cases per 1,000 of women with breast cancer, but that's exactly the same as taking the contraceptive pill. And as it's also emerging, the mini pill as well, the progesterone-only pill. So it's no different to that. But if you're doing regular exercise, at least 2.5 hours or more per week, which I'm sure most of us are, then that's going to reduce the number of that reduces the number of cases of breast cancer by 7. So if you do your maths, increase of 4 with HRT, decrease in 7 by exercise. You see what I mean? See where I'm going with this? It's still, certainly something worth to try. And also the other thing is that it needs a bit of perseverance, but I'm sure we're all good at that as being dancers, right? I was lucky. The first sort of combination I took was fine. I'm actually on that same dosage, but sometimes you do need a little bit of personalization, titration of the dose. And it's not an elixir of youth, let's be honest about this. So I'm not going to suddenly become Mariana Nunez, unfortunately. But, at least it means that I feel I can, number one, do my job as a doctor, important, mental, capacity, as it were. But also I feel that honestly, I feel I'm dancing now as well. I haven't noticed a sharp decline. If anything, I think actually now I understand the technique and I understand all the things I've been talking to you about. I actually think in some ways I'm a better dancer than I was as a youngster. You didn't have much of a clue, and I just thought I just had to do endless this, that, and the other. And you know what I mean? And my nutrition was not the best, I can say. I did have a FHA. So, now actually I feel with all this knowledge and the help of HRT, I'm actually a better dancer. And even with 2 hip replacements, that's definitely in this side. Right. So anyway, the point is, menopause, it's not a pause, right? It's not the end as you know it. It's just a continuation. It's a graduation to menopause, right? And there are definitely things you can do proactively to keep dancing,
Nicky, she's like the bionic woman. She's amazing. Thank you
I am, literally.
Yeah, I think that has absolutely answered the question so fully. Any more questions from the audience? A bit? No, not just yet. Looking in the chat, I had got a couple of things. So definitely the tracking important, and seeing if we can try and get more chat around that in the dance community. I think a bit of it goes on, but probably not an understanding, a deeper understanding of at which points in your cycle, other than, I think when I was training over 20 years ago, it was very loosely things like, oh, well, your pirouettes might be a bit off when you have your period. I mean, it's just really unscientific.
Yeah.
So I think more developments in that area would be great. But also, I think, is there something around RED-D or RED and sleep deprivation? Because although I know in my PhD at the moment, I'm looking at the postnatal bit, I can't help but whenever we have these webinars, I'm then thinking of 7,000 other research projects I want to do. Sleep deprivation, I think, is absolutely huge, and the impact of that with the drop in estrogen, either breastfeeding or perinatal, and then where we are psychologically in feeling confident enough to continue our careers and stuff. I think, is there anything being done around that?
Well, listen, sleep is the chief nourisher in life's great feast.
What a great quote.
You're right. That's not me. That's Shakespeare. I remember that.
We are in the West Midlands.
Yeah. I remember that. You're quite. There you go. I remember that from my O-level English, which is also showing my age. But anyway, I remember that from Bethany, and at the time I thought, wow, that's really cool. And then I realized more and more how important sleep is, because guess what? How much we sleep, it's like our sleep-wake cycle, and that syncs with our internal hormone clocks. So we have the cortisol, for example, peaks in the morning, the awakening response, and goes down low. And lots of other hormones have got their own clocks. So if your sleep if you've got a scheduling conflict with you're not getting enough sleep, or you're sleeping at weird times, or stuff like this, and your hormones are trying to run on their clocks, it's like that's what's called circadian misalignment, scheduling mismatch. I can tell you one thing, being a junior doctor is not good for your hormone health, because there's a massive scheduling conflict. You don't get much sleep at all, And what sleep you do get, then there's an emergency crash call. Anyway, and we know that this has long-term effects on people's health in terms of increased risk of cardiovascular health and metabolic health issues, diabetes, etc. So that's an example how important sleep is, because your body needs it for recovery, and you need to dovetail it with your hormone internal biochronometers, as they're called. And getting out of sync is not good. But certainly, therefore, sleep quality and quantity is of course, therefore, vital for your health and certainly for your performance. Again, lots of studies show that sleep deprived, you make bad decisions. Like, again, why are we as doctors working overnight? Anyway, whatever. So we know that's when accidents happen, right? So that's, again, accidents also coordination of a dancer and more likely to get injured if you're sleep deprived because the hormones are out of whack. So absolutely, sleep. Wow, we could do a whole thing about sleep. But those are the really key things. But the other thing is it's a sort of an interaction though, because if your hormones have got their clocks wrong, in the sense that you've maybe got FHA or you're going through the perimenopause, now the hormone clocks are out of sync, and so those then go back and affect the sleep pattern. So going through perimenopause and menopause, disturbed sleep is one of the key things, because the hormones are varying, so therefore the sleep gets disturbed. Plus you're having hot flushes, so you just wake up in a pool of sweat, which isn't pleasant. And we know this already in the luteal phase, premenstrual syndrome. When your body temperature goes up, you can have disturbed sleep. See, and so then it's a sort of again one of these accumulative effects, that this could also be a time when the hormones are slightly different levels, and that's affecting your mood and your sleep. So absolutely, what can I say? Sleep is absolutely vitally important, and also the timing of the sleep. My grandmother, you've already seen in the slide, she used to say to me, oh, it's the hours of sleep you get before midnight that are really, really important. I thought it was an old wives' tale. And lo and behold, a few months ago, a study comes out proving my grandmother right. So it's like, that's amazing. And again, it's all down to the hormone timing, because all the good hormones, the ones you really want, like growth hormone for body composition, all these are released when you're asleep. So if you're depriving yourself of sleep or not getting in those really important hours of sleep, that's going to mess up the hormone.
Amazing. Nicky, we are on 11. A huge thank you. I know we can get an audible thank you from the there you go, nice. And we were chuckling along with jokes. I know it's so difficult sometimes online, isn't it, to get that feedback, but hopefully by my facial expressions it's been a good mirror of who's here. Nicky is also on our research advisory group with Martin Landveer and a few other amazing experts we have, who we ask on a quarterly basis for their support and advice, and I'm so grateful for Nicky being on that group. Please do check out her book. It's available at all good outlets. It is so brilliantly written, particularly if you are not a medical person. And particularly if you work in the arts, how it's structured in terms of acts, and has lots of awesome quotes and metaphors and some brilliant case studies. I was reading only last night in preparation about one, I think it was Clemency, who was training online, and you were talking about her Red D there as well. So please do go and have a look at that. And let's hope there are more conversations around this topic as we go forward. It just seems crazy. I'm sure, Nicky, you feel exactly the same. Absolutely bonkers, isn't it? That most of our workforce are women, and we are only at this stage of the game starting to really get in deeper to this area of topics. So there we are. So we're going to say bye. Thank you so much, Nicky. Thank you from all of us here in Birmingham, and I'll see you very soon. Take care.
Thank you.
Bye.
Thanks, everyone. Bye.